assessing the neurological system of the client. It is an examination of the neurologic system which comprises the assessment of the mental status, including the level of consciousness, the cranial nerves, reflexes, motor and sensory functions. Some parts of the neurologic assessment are performed throughout the health assessment, like mental status assessment, observing the appearance in the cranial nerves. So first, we will going to inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as onset and aggravating and elevating factors. This orientation to time, place, or person. Also, the speech disorder, any history of lost consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory, or mood swings. Also, the problems with smell, vision, taste, touch, or hearing. If the client does not have any of those, we will now going to proceed to assessing the language of the client. If the client displays difficulties speaking, we will going to point to common objects and ask the client to name them. Ask the client to read some words and to match the printed and written words with pictures. Ask the client to respond to a simple verbal and written commands such as pointing their feet and raising their arm. So, ma'am, I have here two objects and you need to name them. What is this?
Cell phone.
How about this one?
Pouch.
Okay. I also have here a printed materials or ebook. And can you please read this one?
The central nervous system, CNH, is made of the brain and the spinal cord, the nerves of the spine.
Okay, thank you. So, ma'am, now can you please raise your arm? Your right arm. How about your left arm? Okay, ma'am, thank you. And after that, we will now going to proceed to the orientation. Determine the client's orientation to time, place, and person by tactful questioning. We will going to ask the client by the city and state of residence, time of the day, date, day of the week, duration of illness, and names of family members. So, ma'am, can I ask or can you please state your municipality?
Alakokon.
How about your barangay?
Kaaspagan.
So, ma'am, what do you think is the time of today?
9 a.m.
And for the last question, can you please mention the names of your family members?
Ivina, Ernesto, Aaron, Dave, and Josh.
Okay, ma'am, thank you. And we will also going to ask more direct questioning so that it can be used in the assessment. So, ma'am, where are you now?
In the hospital.
What is the day today?
Wednesday.
Okay, ma'am, thank you. Now, we will going to proceed to the memory of the client. We will going to listen for lapses in memory. Ask the client about difficulty with memory. If problems are apparent, 3 categories of memory are tested: immediate recall, recent memory, and the remote memory. So first is to assess the immediate recall. Ask the client to repeat a series of 3 digits, which is 743, spoken slowly. Gradually increase the number of digits, such as 74355, 74356, and 7435672, until the client fails to repeat the series correctly. We will going to start again with a series of 3 digits, but this time, then ask the client to repeat them backward. So, ma'am, can you please repeat what I'm going to say, which is a digit word, a digit number? So, 743,
743,
7345,
7345,
73456,
73456,
73457.
73457.
And now, ma'am, now, you can you please spell or state them backward?
2065347.
Okay, ma'am, thank you. Now, to assess recent memory. Ask the client to recall the recent events of the day, such as how he got to the clinic. The information must be validated. Ask the client to recall information given early in the interview, especially the name of the doctor. So, ma'am, can you please share to me how you got here in the clinic?
I came from school for coming here.
Okay, so can I ask you what is my name?
Jaira Umupa.
Thank you, ma'am. So now, we will going to provide the client with 3 facts to recall. It can be a color, an object, an address, or a 3-digit number, and ask the client to repeat all 3. Later in the interview, ask the client to recall all 3 items. So, ma'am, I have here 3 facts that I'm going to say, and you're going to recall it. A pink color, a cell phone, and 1, 2, 3. So please, can you recall it to me?
A cell phone, a pink color, and 123.
Okay, ma'am, thank you. And lastly, we are going to assess the remote memory. Ask the client to describe a previous illness or a surgery. And now, we will going to proceed to the attention span and calculation of the client. Test their ability to concentrate or attention span by asking the client to recite alphabet or to count backward from 100. So, ma'am, can you please recite to me the alphabet?
A, B, C, D, E, F, G, H, I, J, K, L, M, N, P, Q, R, S, T, U, V, W, X, Y, Z, and Z.
Okay, ma'am, thank you. And for the second test, we will going to test the ability to calculate by asking the client to subtract 7 or 3 progressively from 100, 193, 86, 79, or 197, 94. So, ma'am, I will going to ask you to answer this one, which is subtraction. So, what is 10 minus 3?
7.
Okay, and how about 10 minus 12?
88.
Thank you, ma'am. So, for the level of consciousness, we are going to apply the glass glaucoma scale, eye response, motor response, and verbal response. So, for the cranial nerves, we are going to test the cranial nerves by cranial nerve eye olfactory. Ask the client to close eyes and identify different mild aromas such as coffee and vanilla. So, for the cranial nerve 2 optic, ask the client to read Snellen's chart, check visual fields by confrontation, and conduct an ophthalmoscopic examination. For the cranial nerve 3 oculomotor, assess 6 ocular movements and pupil reaction. For the cranial nerve 4 trochlear, assess 6 ocular movements. For the cranial nerve 5 trigeminal, while the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. To test light sensation, have the client close eyes and wipe a wisp of cotton over client's forehead and paranasal sinuses. To test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. And for the cranial nerve 6 abducens, assess directions of gaze. For the cranial nerve 7 facial, ask the client to smile, raise the eyebrows, frown, puff out cheeks, and close eyes tightly. Ask the client to identify various taste placed on the tip and side of tongue, sugar, salt, and to identify areas of taste. For the cranial nerve 8, auditory, assists the client's ability to hear the spoken word and the vibrations of the tuning fork. So for the cranial nerve 9, gasopharyngeal, apply taste on the posterior tongue for identification. Ask the client to move tongue from side to side and up and down. For the cranial nerve 10, the vagus, assist the cranial nerve 10. Assist the client's speech for hoarseness. The cranial nerve 11, accessory, ask the client to shrug shoulders against resistance from your hands and to turn head to the side against resistance from your hand. Repeat for the other side. For the cranial nerve 12, hypoglossal, ask the client to protrude tongue and midline, then move it to side. So for the reflexes, we will going to test reflexes using a percussion hammer, comparing one side of the body with the other side to evaluate the symmetry of response. So, for the biceps reflex, partially flex the arm of the client at the elbow and rest the forearm over the thighs, placing the palm of the hand down. Place the thumb of your non-dominant hand horizontally over the biceps tendon. Deliver a blow, slight downward thrust with a percussion hammer to your thumb. Observe the normal slight flexion of the elbow and feel the biceps contraction through your thumb. So, ma'am, can you please place your elbow? So, assuming that my other hand is the percussion hammer, since we don't have any of that. Okay, ma'am, thank you. And for the triceps reflex, flex the client's arm at the elbow and support it in the palm of your non-dominant hand. Palpate the triceps tendon about 2 to 5 cm or 1 to 2 inches above the elbow. Deliver a blow with a percussion hammer directly to the tendon. Observe for the normal slight extension of the elbow. So again, assuming that my hand will be the hammer, okay, ma'am, thank you. Now, for the brachioradialis reflex, rest the client's arm in a relaxed position on your forearm or on the client's own leg. Deliver a blow with a percussion hammer directly in the radius 2 to 5 cm or 1 to 2 inches above the wrist of the styloid process, the bony prominence on the thumb side of the wrist. Observe the normal flexion and supination of the forearm. The fingers of the hand might also extend slightly. So we will assume that my hand is the percussion hammer since we don't have any of that. Now for the patellar reflex, ask the client to sit on the edge of the examining table so that the legs hangs freely. Locate the patellar tendon directly below the patella. Deliver a blow with a percussion hammer directly to the tendon. Observe the normal extensions of or kicking out of the leg as quadriceps muscles contracts. If no response occurs and you suspect the client is not relaxed, ask the client to interlock fingers and pull. So again, my hand will be representing is the percussion hammer. For the Achilles reflex, with the client in the same position as for the patellar reflex test, slightly dorsiflex the client's ankle by supporting the foot lightly in your hand. Deliver a blow with a percussion hammer directly to the tendon. Observe the feet and feel the normal plantar flexion downward jerk of the foot. Assuming that my hand is the percussion hammer. And for the plantar Babenki's reflex, use a moderately sharp object such as the handle of the percussion hammer, a K, or the dull end of the pin or applicator stick. Stroke the lateral border of the sole of the client's foot, starting at the heel, continuing to the ball of the foot, and then proceeding across the ball of the foot onwards to the big toe. After that, you are going to observe the response. Now, for the motor function, gross motor and balance test, walking gait. We are going to ask the client to walk across the room and back and assess the client's gait. So, ma'am, can you please walk from here to there? Okay, ma'am, thank you. For the Romberg's test, ask the client to stand with feet together and arms resting at the sides. First with eyes open, then closed. So, ma'am, can you please stand up there? With your eyes and with your hands at the side. So, open your eyes and then close. Okay, ma'am, thank you. Now, for the standing on one foot with eyes closed, ask the client to close eyes and stand on one foot, then the other. Stand close to the client during this test. So, ma'am, can you please stand up there? So, please stand using one foot. And close your eyes. How about the other side, ma'am? Okay, ma'am, thank you. For the healthy walking, ask the client to walk with a straight line, placing heel of one foot directly at the front of the toes and to the other foot. So, ma'am, can you please stand up and we'll do a healthy walking from here to there. And backward. Thank you. For the two or heel walking, ask the client to walk several steps on the toes and onto the heels. Ma'am, please stand up and do the heel and toe walking. Thank you, ma'am. Now, we will going to test the fine motor test for the upper extremities, which is first is the finger to nose test. Ask the client to abduct and extend arms at shoulder height and rapidly touch nose alternately with one index finger and then the other. Have the client repeat the test with eyes closed if the test is performed easily. So, ma'am, can you please extend your arms at the shoulder height? So, ma'am, can you please touch your nose? Close your eyes, ma'am. Touch your nose. Okay, ma'am, thank you. So, for the alternating supination and pronation of hands on knees, ask the client to pat both knees with the palms of both hands and then with the back of hands, alternately and in ever increasing rate. So, ma'am, you're going to pat your knees just like that, and then the backward of your the back of your hands. Okay, so please pat your knees, ma'am. Okay, thank you. So, for the finger to nose and to the nurse's finger, Ask the client to touch nose and then your index finger, held at a distance at about 45 centimeters or 18 inches at a rapid and increasing rate. So ma'am, first you are going to touch your nose, and then after touching your nose, you are going to touch my index finger. So touch your nose using your right hand. And here. And to the other side. Okay, ma'am, thank you. So, for fingers to fingers, ask the client to spread arms broadly at shoulder height and then bring fingers together at the midline. First with eyes open and then closed. First slowly and then rapidly. So, ma'am, can you please spread your arms broadly? And you're going to intersect your index finger to the center or the midline. Okay, so again, with your eyes open. So extend your arms and go to the midline. So this time, ma'am, with your eyes closed, do it again. Close your eyes and then do it. Okay, ma'am, thank you. So next is fingers to thumb. On the same hand, ask the client to touch each finger of one hand to the thumb of the same hand as rapidly as possible. So ma'am, the same procedure, but the only one, and you are going to change from the index finger to your thumb. Okay? So please spread your arms and to the midline. So with your eyes closed, ma'am, do it again. Spread your arms and to the midline. Okay, ma'am, thank you. So for the fine motor test for the lower extremities, ask the client to lie supine to perform those tests. Heel down opposite shin, ask the client to place the heel of one foot just below the opposite knee and run the heel down to the shin to foot. Repeat with the other foot. The client may also use sitting position for this test. For the toe or ball foot to the nearest finger, ask the client to touch your finger with the large toe of each foot. Ma'am, can you touch this one using your toe? And the other one. Okay, ma'am. For the light touch sensation, compare the light touching sensation of the symmetric areas of the body. Ask the client to close eyes and to respond by saying yes or no whenever the client feels the cotton wisp touching the skin. With a whip of the cotton, lightly touch one specific spot and then the same spot on the other side of the body. Test areas on the forehead, cheek, hand, lower arm and abdomen, foot and lower leg. Check a distal area of the limb first. Ask the client to point the spot where touch was felt. If areas of sensory dysfunction are found, determine the boundaries of sensation by testing responses approximately every 2.5 cm or 1 inch in the area. Make a sketch of the sensory loss area for recording purposes. So, ma'am, I am going to touch you very lightly and you're going to say yes if you feel the touch, okay? So, and the first is close your eyes.
Yes. Yes. Yes.
Okay, ma'am, thank you. And for the pain sensation, we are going to assess pain sensation as follows. Ask the client to close his or her eyes and to say sharp, dull, or don't know when the sharp or dull end of the broken tongue depressor it felt. Alternately, use the sharp and dull end of the sterilized pin or needle to lightly prick designated anatomic areas at random. The face is not tested in this manner. For the temperature sensation, touch skin areas with test tubes filled with hot or cold water. Have the client respond by saying hot, cold, or don't know. So, for the position or kinesthetic sensation, commonly the middle fingers and large toes are tested for the kinesthetic sensation. To test the fingers, support the client's arm with one hand and hold the client's palm in the other. Ask the client to close his or her eyes. Grasp a middle finger or a big toe firmly between your thumb and index finger and exert the same pressure on both sides of the finger or toe while moving it. Move the finger or toe until it is up, down, or straight out, and ask the client to identify the position. So, ma'am, I will going to move your hand if you are going to say what position it is. Ma'am, can you please close your eyes? So, identify what position it is.
Up, down, up, down,
On the other hand,
up, down, up, down.
okay, ma'am, thank you. For the tactile discrimination, for all the tests, the client's eyes needs to be closed. 1 and 2 point discrimination, alternately stimulate the skin with 2 pins simultaneously and then with 1 pin. Ask whether the client feels 1 or 2 pin pricks. So, assuming that my fingers will be the pins. So, ma'am, can you please close your eyes?
One,
You are going to identify how many pins I am going to touch to your skin, okay? Okay, so close your eyes again.
1, 2, 3, 4.
Okay, ma'am, thank you. So, for the stygionosis, place familiar objects such as key, paperclip, or coin in the client's hand and ask the client to identify them. If the client has a motor impairment of the hand and is unable to manipulate an object, write the number or letter in the client's palm using a blunt instrument and ask the client to identify it. So, ma'am, I will going to put object in your hand while closing your eyes and you will going to identify it. What is that object? So, first, close your eyes. What is this object, ma'am?
Coin.
Okay, thank you. So, for the extinction phenomenon, we were going to simultaneously stimulate 2 symmetric areas of the body, such as the thighs, the cheeks, or the hands. Ma'am, can you please close your eyes first? Okay, close your eyes again.
Hand. Thighs.
Okay, ma'am, thank you. So, after all the assessment or the procedures, we will now going to document findings in the client's record.